Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम DSSSB नर्सिंग ऑफिसर एग्जाम द 28 ऑफ अगस्त 2019 शिफ्ट फर्स्ट का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर पिछले वीडियोस नहीं देखा है तो प्लेलिस्ट में जाकर देख सकते हैं और वीडियोस के डिस्क्रिप्शन में भी लिंक प्रोवाइड करवा दूंगा। अगर व्हाट्सएप में वीडियोस का लिंक चाहिए तो पर्सनली व्हाट्सएप मी, माय व्हाट्सएप नंबर इन डिस्क्रिप्शन बॉक्स। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। छब्बीस In which part of the uterine tube does the fertilization process occur? A. Ampulla. B. Intramural part. C. Isthmus. D. Infundibulum. Correct answer A. Ampulla. 27. In which type of placental abnormality there is one or more lobes of placenta placed at varying distance from main placental margin? A. Placenta sexcenturiata. B. Circumvallate placenta. C. Placenta membranacea. D. Placenta marginata. Correct answer A. Placenta sexcenturiata. 28. What is placenta accreta? A. It is the condition in which the placenta is anchored to endometrium. B. It is the condition in which the placenta is attached to lower uterine segment. C. It is the condition in which the placenta is attached to upper uterine segment. D. It is the condition in which the placenta is anchored to myometrium. Correct answer D. It is the condition in which the placenta is anchored to myometrium. 29. The slight downy distribution of fine hair over neonate's body is termed as A. Vernix caseosa. B. Lanugo. C. Milia. D. Erythema. Correct answer B. Lanugo. 30. Which stage of labor starts from full dilatation of the cervix and ends with expulsion of the fetus from birth canal? A. Fourth stage. B. First stage. C. Second stage. D. Third stage. Correct answer C. Second stage. 31. How much amount of blood transfers from placenta to the baby after delivery when the cord clamping is delayed till the cessation of cord pulsations? A. 10 to 30 milliliters. B. 120 to 150 milliliters. C. 40 to 60 milliliters. D. 80 to 100 milliliters. Correct answer D. 80 to 100 milliliters. 32. X is facing the problem and he attempts to find a single correct answer to the problem. Identify the type of thinking. A. Creative thinking. B. Critical thinking. C. Divergent thinking. D. Convergent thinking. Correct answer D. Convergent thinking. 33. The congenital heart disease in which radiographic findings depict boot-shaped heart is called A. Patent ductus arteriosus. B. Atrial septal defect. C. Coarctation of aorta. D. Tetralogy of Fallot. Correct answer D. Tetralogy of Fallot. 34. Epispadias means A. Abnormal urethra opening on the dorsal opening of penis. B. Abnormal urethra opening on the ventral opening of penis. C. Abnormal urethral opening at the tip of the penis. D. Abnormal urethral opening at the scrotal sac. Correct answer A. Abnormal urethra opening on the dorsal opening of penis. 35. The phase of ejection of milk is called A. Galactokinesis. B. Lactogenesis. C. Mammogenesis. D. Galactopoiesis. Correct answer A. Galactokinesis. 36. The brownish-black pigmented area in the midline stretching from xiphostinum to symphysis pubis during pregnancy is called A. Linea nigra. B. Striae albicans. C. Striae gravidarum. D. Closma gravidarum. Correct answer A. Linea nigra. 37. Which condition occurs due to the congenital absence of parasympathetic ganglionic nerve cells in the colon? A. Volvulus. B. Hirschsprung's disease. C. Intestinal obstruction. D. Meconium ileus. Correct answer B. Hirschsprung's disease. 38. Which assessment should be done after an amniotomy has been performed to a pregnant mother? A. Fetal heart rate pattern. B. Bladder distension. C. Maternal blood pressure. D. Cervical dilation. Correct answer A. Fetal heart rate pattern. 39. Oxygen toxicity in preterm babies causes A. Respiratory distress syndrome. B. Retrolental fibroplasia. C. Neonatal sepsis. D. Neonatal hypoglycemia. Correct answer B. Retrolental fibroplasia. 40. A nurse is caring for patient on diuretic therapy. The nurse would monitor the patient for which acid-base disorder? A. Respiratory alkalosis. B. Metabolic acidosis. C. Respiratory acidosis. D. Metabolic alkalosis. Correct answer D. Metabolic alkalosis. 41. Anasarca is a feature of A. Copulmonale. B. Right-sided heart failure. C. Pulmonary hypertension. D. Left-sided heart failure. Correct answer B. Right-sided heart failure. 42. Which diagnostic test determines the presence of Hodgkin's lymphoma? A. Presence of Philadelphia chromosome. B. Presence of lymphoblasts in the bone marrow. C. Presence of malignant cells in CSF. D. Presence of Reed-Sternberg cell in lymph node. Correct answer D. Presence of Reed-Sternberg cell in lymph node. 43. Which finding is noted on assessing a child with scabies? A. Purple-colored lines. B. Pink-red macules. C. Discrete red macules. D. Gray thread-like lines. Correct answer D. Gray thread-like lines. 44. What is the correct position to be maintained for patient who shows signs of shock? A. Supine. B. Modified Trendelenburg. C. Reverse Trendelenburg. D. Lithotomy. Correct answer B. Modified Trendelenburg. 45. A patient is in stage of dying and says that, I just want to see my grandchildren's birth, then I am ready. Identify the stage of dying. A. Depression. B. Acceptance. C. Bargaining. D. Anger. Correct answer C. Bargaining. 46. Which is the only immunoglobulin transported through placenta to fetus? A. IgD. B. IgM. C. IgG. D. IgH. Correct answer C. IgG. 47. Which nursing care is to be provided pre-operatively to a baby born with exstrophy of bladder? A. Immerse the baby in water while bathing. B. Cover the bladder with sterile petroleum gauze. C. Place the baby in the prone position. D. Keep the bladder mucosa dry. Correct answer B. Cover the bladder with sterile petroleum gauze. 48. Who described ABO blood grouping? A. Karl Landsteiner. B. Sir Ronald Ross. C. Robert Koch. D. David Baltimore. Correct answer A. Karl Landsteiner. 49. What is the advantage of Venturi mask? A. High concentration O2 is delivered accurately. B. O2 is delivered quickly for short periods. C. Provides moderate to high density aerosols. D. Delivers precise and high flow rates of oxygen. Correct answer D. Delivers precise and high flow rates of oxygen. 50. A nurse assisted in endotracheal intubation. The doctor advised to maintain cuff pressure between 20 to 25 mm Hg. What is the complication of low cuff pressure? A. Risk for aspiration pneumonia. B. Ischemia. C. Tracheal bleeding. D. Pressure necrosis. करेक्ट आंसर ए, रिस्क फॉर एस्पिरेशन न्यूमोनिया। कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोज।